Our next witness is Dr. Brian Blase. Dr. Blase is the president of the Paragon Health Institute. From 2017 to 2019, he served as a special assistant to the president for economic policy at the White House's National Economic Council, where he coordinated the development and execution of numerous health policies. He received a PhD in economics from George Mason University. Mr. Blase, Dr. Blase.
Chairman Johnson, Ranking Member Blumenthal, and members of the committee, thank you for the opportunity to testify today. Because of a lack of options, my family with 5 children has been enrolled on an ACA plan for 4 years, so I've seen firsthand the real problems with the law. All government policies create winners and losers. Unfortunately, the Affordable Care Act created far more losers than winners. The ACA promised affordable, high-quality insurance, and it failed to deliver. Millions of people lost health plans they liked. Millions of families faced massive premium and deductible increases for worse coverage that included fewer doctors and hospitals. The ACA significantly contributes to rising deficits and unsustainable debt, leaving young families, their children, and future generations with higher taxes and inflation. The law entrenched an inefficient, insurance-dominated health sector with massive subsidies flowing straight from the Treasury to health insurance companies. Here are the basic economics. The ACA's regulations increased premiums for most people to decrease them for a small number. Subsidies were then needed so people could afford coverage that the government regulations had made more expensive. The underlying regulatory and subsidy structure leads to ever-escalating premiums and prices. Higher premiums create pressure for still more subsidies. And those additional subsidies only worsen the underlying problems, fueling the very premiums and price escalation they were meant to offset. If Congress wants to make health care more affordable, it must reform the structure itself, not throw good money after bad. In 2014, when the ACA's key provisions took effect, individual market premiums rose nearly 50%. From 2014 to 2016, premiums increased nearly twice as rapidly as employer plan premiums. The ACA's subsidies are ill-designed and inflationary. The enrollee's share of the premium is capped, regardless of the total premium. Because enrollees pay only a small slice of the premium, insurers face virtually no price discipline, giving them incentives to inflate costs rather than improve value. The ACA regulations drove higher costs. For example, under the medical loss ratio, insurers must spend a minimum share of premium revenue on medical claims. In other words, to increase profits, insurers must raise premiums. The ACA's essential health benefit mandates requires all plans to cover the same set of services regardless of what consumers want or need. These rules increased wasteful spending and premiums. COVID-era subsidy boosts resulted in fully subsidized coverage and led to massive fraud in the program. In 2025, there are 6.4 million people enrolled in fully subsidized plans who are not eligible, costing $27 billion. In 15 states, there are more than twice as many enrollees in fully subsidized plans than are eligible. Many of these enrollees were signed up without their knowledge or consent, victims of massive fraud schemes. A staggering 40% of fully subsidized enrollees used no medical services in 2024. Many of these zero-claim enrollees are phantoms. Federal taxpayers sent more than $35 billion to insurers for people who did not use their plan a single time. The ACA's subsidy structure, particularly with the COVID credits, incentivized small employers to drop coverage. The percentage of small employers offering a health plan has dropped by 1/3 since 2010. The ACA has also led some state and local governments to drop retiree health coverage, offloading that expense onto the federal taxpayer. The COVID credits, by lifting the subsidy cap at 4 times the federal poverty level, encourage early retirement. It has led to situations like a retired couple in their mid-50s who earn $136,000 in pension income from government service, receiving $15,000 in ACA subsidies. ACA premiums will rise next year because of underlying flaws in the program. Only a small portion of the increase is from the expiring COVID credits. The underlying ACA subsidies provide enormous protection for more than 93% of enrollees from high premiums. Most will pay less than $80 a month for a plan next year, with the federal taxpayer picking up 80% of the premium cost and a higher percentage for lower-income enrollees. The Inflation Reduction Act set the COVID credits to expire after 2025, and they should end. Continuing them would exacerbate fraud, increase premiums and healthcare prices, drive out alternative financing arrangements, remove the imperative to reform this failing program, and drive the country deeper in debt. Real reform does not mean spending more taxpayer money. It means giving consumers the freedom to choose the coverage and care that best meets their needs. Thank you.